Ooh, somewhere over the rainbow, way up high, and
Hello,
the
everybody. Before we get
dreams
started, I
that
just want
you
to remind
dream
folks if you can just
of
rename
once
your
in a
self,
love.
your first name and your camper organization would be fantastic. We'll get started in a minute or two. Just want to give the 90 some folks that signed up for our program tonight that opportunity to sign on. So if you could just take a couple minutes, rename yourself, and we'll get started soon. It's nice to see all y'all faces, just so you loving scrolling down, seeing everybody.
Gabby.
Beautiful music choice, Matt.
It wasn't actually my choice, but I'm really thankful that it's here because this is probably my favorite song of all time. So.
I mean, just absolutely incredible. That's the mood.
And I come from his home country.
Love it.
Way up high, and the dreams that you dream of once in a love goodbye. Oh, somewhere over the rainbow, bluebirds fly. And the dreams that you dream of, dreams really do.
Matt, I've got it's top of the hour, so I am going to turn it over to you. I want to welcome everybody for joining us tonight for our first town hall of the year. I'm Jennifer Amundsen. I'm the Assistant Executive Director of COCA, and I'm glad you're here. I look forward to the conversation tonight. Matt Rutler, take it away, friend.
Thank you, friend. So welcome, everybody. We're so glad you're able to join us. We have close to 50 people already on the call, with probably another 50 joining us shortly. But this is a hot topic, so we definitely want to make sure we can get as much time in as possible to chat. Just a few things we want to go over on these slides to give y'all a heads up of what's coming. Again, if you can rename yourself with your name and your camper organization, that would be awesome, just so we know who we're talking to, even though we know who y'all are. But again, if you can turn on your video, if not, it's okay. We understand that. And we're hoping that this presentation will last. It could probably last a lot longer than 45 minutes, but we're going to get as much in as we possibly can. And again, it's really driven by your participation. Please, the chat, it will be open. So if you have questions as we go through this, please put it in the chat box. Our wonderful Jennifer and Dawn are going to be monitoring the chat for us. So if things are put in there, we'll make sure that those questions get answered, or asked at least, and then put out to the group to be answered. We do have a few other sessions coming up on our calendar. Next Wednesday, February 17th, is our second town hall, The Future of Camp, Summer 2021 plan. So we have a few of our phenomenal camp folks who are going to lead our panel discussion next week about those future plans for summer 2021, and that is on the books. We also have the following Wednesday. We got a thing for Wednesdays, folks. February 24th, we are going to have our next town hall with COVID-related questions you need to ask your host camp facility. So if you don't own your site, you either partner with another site, you rent your site, whatever the case may be. It's very important to have a list of questions and resources to go to those folks in order to plan ahead and know what's coming. So this is a great opportunity to ask those questions, hear from folks who own their sites, and get some great and useful information on what to ask your host camp and your host site. In March, Tuesday, March 2nd, we are going to have our first medical town hall. So it's COVID and vaccine updates. Dr. Rafi Landovitz, our infectious disease clinician, excuse me, out of California, will be on to answer questions and to give us some updates on COVID and its current vaccine rollouts. So please feel free to join us on that date. Please send it to your medical staff as well. All of these sessions that we have currently planned, you can find on the website, outsidethebox.coca.org. Feel free to visit that site. That's also where you can find the link to register. And when in doubt, you can always just send us an email. Other things that we have that we are in the process of planning for y'all, we wanted to do something different, something fun. So Wednesday, March 24th at 8 o'clock Eastern time, myself and a few of my other camp friends are going to be running an arts and crafts session, a virtual arts and crafts session of different arts and crafts projects that you can do in a virtual setting, but can also be applied to in person. So come, we'll send you a list of craft items for you to go to the dollar store and get, because I'm all about the dollar store, and come and do some arts and crafts with us. We'll also be doing some staff development and training. What does that look like for 2021? We will have a networking social hour, virtual games and activities, as well as board development. So these are all in the process of being planned out. We'll come up with dates. As soon as we do, you will hear from us. But you can always check back on the website to get those updates. All right, so please feel free to sign up to all the things that have the dates. The first 4 are already up, so you can register and get your link for those meetings. So thank you. So that's all of those announcements. So we are very fortunate tonight. We have 3 wonderful folks with us who are going to offer up some of the things that they are currently planning, things that they're in the process of thinking, whether to go to an in-person camp or to a virtual camp. So I'm very, very happy to introduce our panel tonight. We have Ryan from Happiness is Camping, excuse me, here in New Jersey. Welcome, Ryan. We have Sally from our friends in Georgia, Camp Sunshine. So thank you, Sally, for joining us. And we also have Brian from Camp Ronald McDonald, the Good Times out in California. I believe he is on. He may be on one of my other screens, but he is here. So these 3 folks are wonderful, and they are going to give us a plethora of information, but also is an opportunity for us to talk to one another, ask questions, and really hear from one another, learn from one another as we make these difficult decisions on what to do for summer 2021. So I am going to put it out to our 3 panelists to kick us off. I'd really love to hear, and if you could, share with the group, what are you currently doing? What are you currently thinking, working on as this process is unfolding for all of us? And I will open it up to, I believe, whomever would like to go first.
Yeah, I could start us off. Thank you so much, Matt, and thank you for everybody being here. My name's Ryan Campbell. I'm from Happiness is Camping, as Matt said, in New Jersey. So we just met with our board and our medical council last week, and we have decided that we're opening this year and we're reoffering in-person programming. And right now, we still have NPIs, non-pharmaceutical interventions in place, but we're still planning on having kids on active treatment just as we normally would, and siblings, kids in remission. It's basically full steam ahead. We're planning on reducing our capacity, but when we were considering what to do, basically we set 4 criteria that if the answer was no to any of these questions, we would not reopen this year. The first one was, did our medical council think it's safe to open, which unanimously they did this year, when unanimously they all did not believe it was safe to reopen last year. 2, do we have any state restrictions? So currently the answer to that is yes, but hopefully New Jersey will lift the residential camp restriction. The word is in the next couple weeks that might happen, so fingers crossed. 3, can we reasonably implement the ACA field guide? And we've probably been on at least 100 Zoom calls about that. So we met with our executive director and myself, really the only 2 full-time staff we have here. And it's basically all we talk about all day long. So the answer to that was yes. And then we own our own facility, but the 4th question that would definitely close us, obviously, is your rental site renting or even opening this year. So with that, I'll let somebody else take it away.
Thanks, Ryan. Sally or Brian, if you can offer what you're in the process of doing, what your thoughts are working towards this.
Sure. So this is Brian, if that's okay, Sally. Very similar to Ryan. Just for those of you who don't know, we have 60 acres here in the mountains above Palm Springs. We serve primarily children with cancer and their families for 6 of those weeks. We do have some partner camps that we also do rentals, those kind of things like MDA, Crohn's colitis, and other. A little behind Ryan's time schedule, we actually have a medical advisory committee. We have a great group of doctors, nurses, social workers, that kind of thing. It's actually on a formal advisory committee for our organization. And we're actually meeting next week with regards to this exact topic. We've given ourselves until like about March 1st to kind of make a decision for summer. And so we've been working with a subcommittee of clinicians and that kind of thing, just to kind of say, what questions are we going to ask? And then that will give us the green light to then follow quickly, as Ryan illustrated, in how do we provide a safe environment. So for those questions, really, I mean, the first one that we're coming out with is, is this group willing to endorse for us to do some kind of an in-person camp experience for 2021? If it's no, then we're going totally virtual. We had planned to do virtual and live if possible, but as we know, this is all very fluid, especially in California. And as Ryan mentioned, right now in California, at least also in our county, if not the whole state, is we are not permitted to operate camp. So camp is off the table from the health department. So that would have to change.
Brian?
Yeah.
Brian, can I interrupt I apologize to interrupt for 1 second. Is there any way that either you could speak up or just increase your volume?
I can probably do both.
There's just a few folks that are having difficulty hearing. Just wanted to recognize that.
Is that better? Or no?
No, I'm getting the no.
Can you hear me now?
Oh, there we go.
Okay.
Thanks.
So, thank you for Matt for jumping in and saying that. So we're just trying to figure out, California is now not allowing camps. We have a lot of conversations across Southern California and the state to see if that'll happen. But to our medical committee, it really is, are they willing to explore and endorse us to have in-person camp? And if so, then it comes down to sub-questions like, is everybody going to have to be vaccinated or no? And by everybody, we put that into 2 buckets of staff, and we put that into campers. Also, are they willing to do some kind of hybrid in person that might be, for instance, we've explored, we do survivors and well siblings. And by well siblings, there could be a lot of other things that go into siblings with regards to if they have diabetes and other kind of things that are recommended not to put at risk. So we kind of have this stair-step kind of question going through them. And if those become positive, then we'll actually put into place. We assume, and a matter of fact, I have my final meeting, I think tomorrow, with some of our final kind of precautions to put in place if we are going to go in person. It definitely looks like reduced amounts. It definitely looks like a lot of cohorting at this point of cabin groups, modifying what program looks like. All those programs that we've always done is kind of like, not necessarily on the table. We're going to be creative outside of that, figure out how we can reach those support needs our campers have, even though we may not be able to operate as usual. We've also put family camp. I know many of you also do family camp. Family camp's on the table as well. And family camp for us is spring and fall. We've said no to spring, but if we decide to do fall, that will be a decision later down the way. So there's kind of this, very large kind of flow chart that we're going through to make that decision. One of the other ones that has come into this that we internally have talked about that I just wanted to bring up is, even if our medical committee, which is made up of physicians, we serve, I want to say 12 to 10 pediatric oncology programs here in Southern California. It's not just one. But and many of those doctors are on this committee, but if the committee says go ahead, can we get the support of oncologists, immunologists, those kind of things at those different facilities as well? So it's kind of like, yes, but, and then we kind of work through all of that because we figured that it's important for us to have support from those that actually provide our campers, that they feel comfortable that we're being safe. Of course, we know that we want to supply them with a lot of information with regards to, as Ryan mentioned, those non-pharmaceutical kinds of interventions we might do. Also, what kinds of screening we'll do beforehand. And so we're also going through the loops of taking a look at what kind of screening that your staff would need, kids would need. Right now, we're talking about creating a bubble of staff that would basically come in a week ahead of time. That would, we'd make sure that they're safe for a week without campers. We would train. We've used all volunteers, so we're actually even reaching out and say, we'll pay them. And they'll be with us for a month. And then campers will come in every week for about 3 weeks. So we're exploring that kind of option as well, just to see, and we're actually floating that to our medical committee. As we said, let's come up with a plan and let them throw holes in it as we go along. So it's a developing kind of piece as we go along. So that's been kind of our conversation along the way. And I know I've spoken way too much, so I'm going to turn this over to my friend, Miss Sally, and with her question.
All right. Well, I think Ryan and Brian have hit about all the questions that we all answer or ask ourselves. We're coming from a position of being, we do not have our own facility like many of you. So the number one question for us is, we're a partner camp of Camp Twin Lakes, is are they going to open, and what are their guidelines and what are they doing in order to open? And so they've given kind of a March 1st deadline or target for all their partner organizations that they're going to make their decision. And I feel we're fortunate that we have a camp facility that we feel very comfortable with, and that they're following the field guide and doing as much as they can to provide a safe environment should we have in-person camping. And they've actually been having in-person family camps this past fall and this spring as well. So they're doing that in a very different kind of format, with the families acting as cohorts, and they go around camp together as their own family. So that's number one, will the facility open? And they've kind of given us 3 scenarios. A, they will do in-person camp with cohort campers, and they've got it lined out with a lot of things adjusted, meals adjusted, about 50% size of the cabins, and the different things, safeguards that they're going to provide. Number 2, they might change the format to family camp, so that if we have a week blocked off in the summer, instead of having the kids come and be in camper cabins, they would continue this format of family camps for that period. And then their scenario 3 would be they provide virtual. So that's number one. We have to make sure that we feel comfortable with what our facility that we're going to be renting from would be safe. But just as important as that is what our medical staff says, just like Ryan and Brian have said. And we met last with our medical advisors at the end of January. Things were not looking good. So we will meet with them once we know what Camp Twin Lakes direction is going to be in. We'll meet again with our medical advisory to guide us. But they are not very optimistic. They were not very encouraging for being able to hold in-person camps. So we have also taken the position that we will hold virtual camp regardless of what else we do, because there will be so many kids that can't come to camp. When you think about, we bus kids, so many of the kids, it's difficult to just get their medical forms. I can imagine if we're going to have to do all of this pre-screening and testing, and there will just be a lot of kids that won't be able to get to camp even if we did in-person camp. So and also because of their health situation, the doctors might not let them come if they're very immunosuppressed, or especially with with the smaller sizes of the cabins, we won't be able to take as many. So we've taken the stance that even if we do some form of in-person, we are going to have a virtual camp to be able to include more kids in it. So that's kind of where we're standing. We're on a bubble right now. We're looking at the same March 1st deadline so we can let our families know. We're getting calls every day from parents wanting to know. I think our parents trust us. And if they say that we can do camp safely, then they're going to trust we do. And so that's a tremendous responsibility. And if those of you who've been on the ACA conference sessions last week, what we heard is, don't think if you have COVID at your camp, think you will have COVID. And are you willing to accept that? And how are you going to deal with it? Because it will happen. So you have to look at it that way. You can do everything to prevent it, but you have to be able to know, okay, if it does come to my camp, am I willing to take that risk, and how am I going to handle it? So there you go.
Thank you, Sally.
Hey, and if I can just share, because Sally's still right. I think that I think I talked a little bit about logistics, but I think there's another layer of conversation. I don't know if the questions are going to go there, Matt, but I just wanted to bring this up. And this really has to do with, I kind of put it in two ways. One is our equity, and one has to do with our culture. And equity really has to do is if we do reduce camp, with certain campers not being able to attend either because of pre-existing medical conditions, either that or, and that goes with siblings and all that because we do it all together. But it's like, are we willing to step out there and to do that as a camp? And is that a message we want to send, number one? And number two is, can we, even with adaptation, which we're so very good at, can we still achieve the outcomes and the culture that we really want to have for camp or not? And the other piece is financial. Financially, can we do that? Because there is going to be increased cost. There's also going to be, relationship with donors, all of that kind of thing. And so it really kind of demands. And I will say that I know from looking at this call, we also have, day camp options as well. And interesting, in California, they're allowing day camp, but not overnight camp. So it's just an interest. So we've even taken a look at that option. And we are taking a look at that option. So just to kind of put that out, and I know provinces and states are all different, but I just wanted to throw that in. Thanks, Matt.
Thank you. And there are pieces of that we are going to be touching upon, which gives us a great segue. And a lot of questions have come up already in the chat as far as what are folks doing and what are their plans. So because it's like magic, because that's how camp is, we are going to throw out a poll to everybody. There are 3 questions, and Jennifer is going to launch that poll. And we're actually asking you, what are your plans? What if you have already made your decisions? What does your decision timeline looks like? What types of camps are you considering? And if you're hosting in person, what populations will you be serving? So if y'all could just take a quick second and do that poll for us, we'll be able to give you all the results to talk about.
It won't submit.
You might want to scroll down because there's 3 questions, I believe. So sometimes you can see the first 2, but not the third. I don't think it'll let you submit unless you do the 3rd question.
Well, it won't let me scroll.
How curious.
Oh, there. Okay.
Got it? All right, perfect.
Okay.
Beautiful. And then once obviously everyone has submitted, we will post those results so y'all can see, and then we'll move on and keep discussing our topic for today.
Almost there. 87% have voted. Everybody needs to cast a vote.
Need to be in it to win it, people. In it to win it. right, so as the folks are posting, I am going to pose a question out to y'all that we'll discuss right after we give you the results. But it's come up a few times about, parents and staff willingness to attend camp. So I am going to pose this question out to our panel, and then if anyone else would like to jump in about specifically, how have you reached out, and if you've reached out to family to give them updates, the campers updates on your decision-making process, as well as not just the families and campers, but your staff as well. And are you seeing anything in terms of a change in availability, whether or not they will be able to attend, won't want to attend? We're at 91%, so we're getting there. We're getting there. Just hit the submit button, y'all. But that's the think about that as our next question. We started to talk about our families and campers, but I am curious to hear from y'all as far as how we are reaching out to them, to keeping them updated, and what feedback we've been receiving from them and staff.
Hey, Matt, just to jump that off while we're waiting for more responses, and this is no gold standard by any means, but I know that through all of this, we have had regular town halls with all of our families. We've invited all of them. There's usually been some kind of agenda just to kind of take a pulse read with regards to virtual camp, when they wanted it, what they thought. Oh, there's results. Awesome.
And there's your results, folks. So if we take a quick look, so we have a good amount of folks that are still in that process. I know I saw a bunch in the chat that March 1st, as Sally has said, is the decision time. 34% have already made that decision. And if we look at what types of camps we're considering, more than half are looking at a bit of a hybrid model, in person and virtual. Obviously, there's a stronger percentage of virtual over the in-person. And then obviously you can see then the breakdown of if you're hosting in person or virtual, what populations will you serve? So if y'all want to take a quick look at that.
That's super. But kind of continue on. So we've kind of kept in touch, and they've been actually very informative. They've also been very praising of us and what we've done to kind of hold off to this point for the safety of their families. So as we take a look at summer, and with vaccines coming out, we're excited for our next one just to kind of see where people are. So we have regular town hall meetings with both our volunteers and with our families. And that's been truly helpful to kind of guide us along the way. And we've been transparent with that. Also with us reaching out to them with emails and all those kind of things. So I want to say we've probably had those at least once a month with our families and our volunteers in different formats. And some of it will be fun, and some of it's asking for information. So that's what we've done here.
And Brian, when did you start those town halls, as far as this month, last month, in the,
last February.
Last February. Okay.
February 2020.
Okay. Thank you.
So to jump off what Brian said, we have a Facebook group that has almost nearly all of our active campers and alumni and everything like that we've been using for 10 years now. And we try to update it weekly, and I put informal surveys in there, and we've had overwhelming support from our family. I know the whole camp industry as a whole right now is kind of nervous because it seems like parents are almost too eager to send their kids to camp. So a lot of people are thinking, I'm just tired of my kids being home, so please take my kids. But I think with our population, I think our parents really understand the fragility of life. So our medical council didn't think that was a factor at all. They understand what the risks are, and they've still been overwhelmingly supportive. And then for staff, we have about 25 paid staff, and then about 50 volunteers that come. We do 5 weeks of camp. And as usual, we're overflowing with female staff and applicants. And like much of the camp industry, we can't ever seem to find male staff volunteers. But that's for paid staff. But as far as the volunteers go, I've had an overwhelming number of applications already. I would say I'm already about 60 to 65% full of volunteers, and I normally don't hit that point until like June every year. So I think people are eager to get back to camp, and the Facebook group has kept people engaged throughout the entire year.
Thanks, Ryan.
I will say same thing. We have an, Facebook and social media and emails. We've only had one town hall meeting. I think that's a great idea, Brian, to do that. We've only had one of those this year, or last year, but we've had a pretty robust ongoing virtual programming schedule where we've done a lot of virtual programs last year and continuing on this year. So we have a lot of, I would say, contact with our families and have monthly educational training sessions for our volunteers. This week we're doing a volunteer game night, so we're trying to stay engaged with them and updating our website and updating our volunteer email newsletter as we go along. So trying to stay in touch and give them as much information as we can.
Great. I'm seeing that in the chat as well, that we're having a number of folks who said that they're working on polling parents, asking staff questions. They agree town halls are a good idea. So that's something that I will consider myself actually as well. I'll just give a little bit for our camp. We actually have already made the decision as well to go virtual at our camp. We do not own our site. We rent. One thing that some of the questions that we had to ask in our rental as well is the fact that we are based in New Jersey, but our campers come from 3 different states. And our site that we work at or host our camp at is actually in Pennsylvania. So it's not also in our own state. So, their state regulations in New Jersey are different than state regulations in Pennsylvania. So that helped with or guided some of our decision making. One thing that we've run into, and we did the same thing. I just recently put a poll out to our parents, and we've actually had very mixed feedback from our families. Some are eager to send their kids to camp, and others were basically begging for a virtual program because they don't feel safe to send their kids to camp. So, we're a very large camp, at least I think so. We run a 1-week program with about 150 kids and 100 volunteers. So it's a very large group. Plus the site that we rent, it has at least another 75 to 100 staff that are there while we're there. So, the capacity and the sheer numbers, our medical team and leadership team had to take into account. So, we're in that kind of state now, but, I'm in the chat. It's great that I'm hearing folks, and I'd love to get some more folks. So please, if you have other questions or more information about what you're doing in your camp, please overload that chat because we're watching it. So we'll be able to ask those questions. And also, obviously, that chat will get saved. So when we have the video, the recording of this town hall, the chat will accompany it so that you'll be able to get all that information as well. There's a good question that asks, what are you, and it's posed to Brian, but I am going to pose it out to everybody because that's what we do. What are you doing to gain endorsements from your hospitals and the hospitals that you are affiliated with as far as where your campers are coming from? So what are you doing to work specifically with those hospitals to get their endorsement? Brian, I'm sorry, you're on mute, bro.
Thank you. And so, yeah, for us, we've really been coached to present a plan. So that's why we're kind of holding off until we know where we're going. But what a plan would be with regards to opening, what screening eligibility would look like, what kind of, and along with that, what kind of pre-screening into camp, as well as what kind of, how we'd actually operate while we're there. And then with that plan to present it and kind of with the idea of setting appointments up with certain decision makers. Number one is to kind of get their feedback on that, but also to educate them that this is where we're going and if they would feel comfortable. So we're identifying who those leaders are in oncology departments across all of our hospitals, and we're putting together that kind of plan and setting up those times just to kind of see. And we know that if we decide to go that direction, there may be a hospital or so that don't feel comfortable. If we're overwhelming, they're not comfortable, of course, that will be an indicator for us as well. But it really is, but we really figured we didn't want to just have a casual conversation. We wanted to go in with a plan. That's the image we wanted to share. Hey, we can handle this, we think, if we decide to go that direction, and we want your feedback with regards to this. I will also say that some of that is also guided because we're a part of Ronald McDonald House Charities. And I see Cindy on this call as well, who's Ronald McDonald House Charities. And to open up Ronald McDonald House, a lot of work has been done with regards to your relationship to host hospitals, what kind of eligibility and screening would be done. And we need to kind of take that into account. So we got some coaching from there, but that's kind of the plan forward.
Ryan or Sally?
Yeah, we did the same thing that Brian did. We went in with the plan. We had a whole screening plan, a whole testing plan, a whole cohorting and the MPIs that we were going to use. And we kind of overwhelmed them with our policies and procedures. Remember, the one thing that I kind of learned throughout this entire process is that they're the medical experts, but they really don't know anything about camp. So when you think that they don't know anything about camp, think of how scary it is to approve camp. So you have to make them understand what your camp is going to look like as much as possible. So all of the people on our medical council all represent the largest hospitals that we get our kids from. And they were basically, they just told us, yes, it's safe, no, it's not safe. And from a cancer and a general COVID point of view. And then once we told them our plan, they thought, okay, yeah, that sounds safe, as safe as can be. And really, we just used the field guide and tailored it to our oncology population.
I really don't have anything else to add to that, just because, as I say, we use another facility. They have the plan. They presented the plan to the hospital that we use. Now it's just a matter of whether or not our oncologists feel like for our population that will work. It might work for some of the other groups that they're using, but whether or not for our population it's going to work and that they feel comfortable. So that's kind of where we are.
Right. And that's a great point, Sally. You know, the fact that we partner with another site, we use their site, we follow their policies as well. So then taking their entire plan into play, adding it to what we currently do as our own camps and making them mesh and making sure everyone approves and goes through it. There was a question that came up and when we're talking about screening, potential screening of campers, of staff, I'm curious what your all's thoughts are on screening, but also on the potential for PPE. What does it look like? Are folks looking at hand sanitizing purchases? Are we looking at masks? You know, that's a huge thought process, you know, as we go through the world we're living in right now. You know, sometimes in certain areas, there's such a shortage. So I'm curious to hear from you all as far as what has your thought process been in regards to screening and the use of PPE at camp?
So Matt, real quick, I know there's a lot of stuff going on in the chat and about staff and if they're leaving or not. That's a great question. That's something that we put up in the air. We are not letting staff leave. So staff are actually going to be at our camp for 7 weeks, and normally they would be out and about and going to Manhattan, going to Philadelphia and all over the place. But we let them know right away that we're creating a bubble at camp. So expect to be here from June 19th to August 5th. So that's what we're doing. But as far as your question, the state of New Jersey came out with a really nice checklist to send home to every single camper. So we're going to have them do that checklist for 14 days leading up to camp. And it's basically a daily temperature check. Have you had a temperature over 100.4? Have you had symptoms? Has anybody in your family have symptoms? Have you been around a known COVID case? Have you traveled within the last 14 days? And it's all questions like that. And it's a nice, easy checklist. You just check off the box, yes, no. And if you ever answer yes to it, the state of New Jersey wants you to restart for another 14 days. And then that's something that they have to submit we're going to make them do it the day before they arrive at camp, just in case somebody forgets to bring it with them. And then PPE, I'm looking at a entire shelf full of about 10,000 latex gloves and at least 7,000 disposable masks that we're using and everything. Now is definitely the time to get it. Over the summer, I know a lot of camps around here that were open couldn't get any PPE at all. Right now, it's widely available because everybody's basically making it their side hustle that is loosely related to the medical community. And it's fairly cheap right now. So I definitely recommend getting it much earlier than you typically would.
And I actually posted on the chat. So there's an ACA resource center, which is open to everyone. You don't have to be a member, but on that resource center, it also has resources for PPE. It also has guidelines with regards to that an independent research is done with regards to how to operate, what kind of PPE, what kind of, it doesn't go as depthly into screening. It's more like operation once you're there. Mask availables, hand sanitizers, cohorting, all those. And it also walks through some specific activities and what you should consider in making that decision. So I put that up there just as a resource. I know we're using that extensively. And yeah, I agree with Ryan. I mean, we have, we couldn't find masks, and now I'm overrunning in masks. And we have all kinds of hand sanitizer as well. So there was a real shortage, but I think, as he said, I think there's a lot of people coming to the call. And so I'd also use those networks that our camps are so well locally, just to explain what that need is. If you're trying to figure out how many you would need, the guide can be really helpful with regards to PPE to kind of calculate. You might also want to contact your healthcare team to find out, because they definitely have a different usage than just counselors or staff that are at camp with regards to those needs.
So there's some, as we said, there are some great stuff going on in the chat. So please, if while you're listening intently to as folks are speaking, please make sure you are checking on the chat, because there's a lot of questions, a lot of great feedback from what other camps are doing. There are a couple of questions that go along with what we're talking about as far as PPE is concerned, as well as pre-screening. And I do have that question as well, thinking about who's filling out the survey and who's evaluating the survey, or not survey, but the pre-screening. So, Ryan, especially if you could touch upon that as far as, who's going to be evaluating if you do pre-screening surveys leading up to camp. I mean, I know you have an extensive medical staff or medical team, but I'm curious as to who will be the ones checking on those surveys and the validity.
Sure. Yeah. So it's basically just going to be up to our camp nurse, who is also our board president, but she works here the entire summer. So she's going to be checking up on that. She's our main point of contact in the infirmary. And I'm sure if she has any questions, it'll go to our medical directors. We have 2 medical directors as well that would do that. But I saw somebody put something about asymptomatic kids, which is definitely something that, we're concerned about. So we have a pretty robust testing strategy too. There are a lot of testing sites that are popping up right now, a lot of groups that will come out to camp to test. We just met with one today, and they're going to do all of our tests for $1,000 for the entire summer, just a flat fee. And then it's going to either the kids' insurance, or if they don't have access to insurance, and if they're on Medicaid, then it's actually going through the CARES Act. There's a stipulation in the CARES Act that is going to basically pay for their tests. We also have international staff, and they're our biggest expense. So we have to pay $100 out of pocket for international staff, but everybody else is either covered by insurance or the CARES Act.
Any other folks want to comment on that? Okay, you do bring up a good point, Ryan, and I'm going to pick on you again. I apologize, but you brought it up. And there are a few folks I know on the call, and a few folks, members of COCA, that do have international staff, whether it's their actual campground that has international staff or their partner camp, their host camp. I'm curious as to what have you heard, what's been going on as far as the international groups coming in. I know I have, I have actually international staff that come in, my counselors, and right now they are, there's a travel ban, so they're actually not going to be able to come if we were to have in person because of the current travel ban. So I'm curious as to what you're hearing as far as the international.
I see Beverly's comment. That's funny. We just hired 2 Kiwis today because basically they're allowed out of the country and then they're not allowed into New Zealand as easily, but that's New Zealand's problem once they get over there. But so the Department of State, the State Department had a really nice presentation at the ACA National Convention. And they've made this a priority because, they used a bunch of government jargon and they wouldn't put any question, they wouldn't answer anything solidly, but it sounds like they're making this a priority and they're recommending hiring staff from a wide variety of international places so that, if one's banned, others are not. So we have staff coming from Turkey and Turkey's just wide open and they'll let them go in and out as they please. England's actually the hardest right now and that's who we get most of our staff from, but they're pretty confident and they told them to go get their visas right now. And they actually have to arrive per CDC recommendation. They have to arrive into America with a negative COVID test. So they'll at least get to camp knowing that they're negative and then they're going to quarantine while they're at camp. We're doing a 2-week staff training, which is much, much longer than we normally do for that 14-day incubation period to cover that.
Brian, I'm sorry, you're on mute again.
I just wanted to mention that I know that many of our COCA camps they have one session or they have 1 or 2 sessions. They don't have multiple sessions. And so it's kind of thinking about how do I quarantine? How would I do that? They don't pay staff, which I don't either. We're looking at doing it this year, but it's like, how do you manage that when they come from all over and you're only doing 1 week? And that is a challenge. And that might be one of the give me's of saying this is not tenable in order to ensure safety. I think that's one of those evaluation factors you have to take a look at. And not all of us are in the same situation. So, we're talking, I'm talking about one camp, it's all Southern California, and most of our volunteers are here. Ryan's talking about, he has, staff that come from there. Sally's talking about using a facility that has staff, and that she has here. So how do we screen? How do we make sure? All of these in the title of this town hall are things that you need to consider in order to make a decision. Are we go or are we not go? And there's no clear answer. You have to make it what's going to be comfortable for you. And I understand for all of us, it's going to be different depending on how we operate. So I just wanted to acknowledge that.
Thank
Yeah,
you.
I think that's a really good point, Brian, because everybody's coming from a different place. And I think that the challenge that we've been given is to throw out some of the things that we have considered. So hopefully if those are things that you identify with, or that maybe you'll hear something or see something in the chat that you have not thought about. And so thank you for saying that, Brian.
Yep. Absolutely. Absolutely. And there's a few more things that I'll put out to the group that they're talking about. A few folks are saying, Michelle brought up the fact of in the state of Maryland, they're currently not allowing their camp to have any children at their camp that live out of state. So, that might affect a few other folks who have kids who come from out of state. There's also another question about out-of-state volunteers. Are you requiring them to travel and quarantine prior to your session? These are great things and important things that everybody needs to truly think about and process and work through as you're making those decisions. Obviously, those who have already made their decision, this is definitely something that to keep in mind as you progress, as more and more things come up, as the pandemic continues, as vaccines become available. Obviously, this is one of those ever-changing types of things that we have constantly have to be re-looking at it and re-examining it. There was a question of where do we find state guidelines for camps and staff? You can find a lot of that on your state's Department of Health. Also, you can also check things out as far as the ACA is concerned. There is a few things that would be more specific, obviously, to state by state as opposed to national. But the majority of the information you're going to get for guidelines for camps, whether they're day camps or residential programs, is through each individual state's Department of Health. They're the ones who really set the standards for your given state. As far as Canada is concerned, and I'm hoping somebody from Canada has joined us on this call, then maybe y'all can help me out and let me know what that guideline is for Canada. Is it individual provinces that set those guidelines, or is it a governing body?
Yeah, good point. Hey, also, can I just kind of respond, because I saw another one coming about funding this. Mm-hmm. And I think that that's another one of those things that we really, as camps, need to consider. You know, as we go to funders, and gosh only knows it's been a struggle when we're not doing program, when we're still looking for funding, whether or not that's for staffing or doing virtual programming. And I think also going forward with regards to funding, if you're taking a look at reduced amounts of in-person people that you might be sharing, or doing both virtual and in person, just as we've been talking about, you know, how do you keep in touch with your campers and test their pulse with our families with regards to that? I would suggest with funding sources doing the same thing, having conversations with them, being willing to share. They know that this is very tenuous. They know it's really moving, but it's an opportunity to kind of share, here's what we're trying to achieve in the lives of these kids, and we have to kind of do it maybe differently, but the support is still needed. Here's what this is going to cost. Can we count on you? Do you know of others that might join in? Because hearing about it at last minute is tough, but even making them a part of that planning and what you're thinking about, they can give great resource, great relationships into that. And I think it makes them a part of that family rather than just getting a report at the end of the year. Here's how much you served. Also, if some of them can't come up to camp, but maybe they can go to virtual. We've had so many of our donors jump in on our virtual camping and gotten great results and great feedback from them saying, gosh, this is amazing, because they actually got a feel of camp a little bit more than sometimes when they come up to camp and they have to be on the outline. So just something to think about if you're trying to think about what that funding piece is outside of just the regular operation piece, is to include them too. But I think it's our opportunity to share with them how necessary this is for these kids, even though they may not be able to meet in person. But that connection's important. We need their support. So I just wanted to throw that in there.
Great. And then I would love to ask that question for folks. You know, have you reached out to donors already? Have you received any feedback, even whether it be this year or even from last year, as far as when you ran your camps? As far as any feedback from them, as far as will they continue making donations? I know there's somewhere in the chat, but I've also experienced in conversations with other camps that funding became more difficult for some donors when camps went virtual. Some donors increased when they went virtual. So I'm curious, Sally, Ryan, Brian, have you had those conversations? Have you received feedback from any donors as far as making the transition from in-person to virtual, or going back to in-person?
Yeah, I can answer it for us. Our experience has been very positive. There have been a few foundations that maybe redirected their funds last year because of other priorities. I can only think of one foundation or one funding source that said, we're not going to fund any camp programs that are not in person last year. And that was only one. So we've had very positive, very understanding, very supportive response, I think, from our donors, especially towards the end of the year. Things really picked up. So,
great. Thank you, Sally.
And we experienced that same, Sally. We experienced that same.
I think the key is all communication, to let them know what you're doing, to show them what you're doing in a variety of ways, and that's the key. That, you know, and our program is much more than just the 2 weeks that we're at summer camp. We run things all year long, and so we do have the advantage of showing what all we're doing year long. But I think it's the key is communication.
Yeah, we actually saw probably a handful of foundations pull their funding last year or decrease it, and then they told us this year if we're only virtual, they're not going to give us any. But it's mostly because of the foundation's mission. One that comes off the top of my head gives us money for medical supplies. So they said, well, if you don't have anybody on site, you don't need medical supplies. So it really is based on the foundation's mission. And when we went virtual, we had a lot of funding pulled. Other people saw that we were struggling and upped their donation, but I think it balanced out or even went a little more decreased funding because of it.
Yeah, and I want to say we experienced the same. It's kind of this tilt. I will say where I think we found some positive results is we really did a lot of in-person campaigning with regards to buy a box for a kid. Here's what we're trying to do. Let's, kind of meet this challenge. And everybody recognized that challenge. We had a lot of people come forward with personal gifts, raising gifts, recruiting others just to make things happen for these kids. So as much as we go sometimes to the foundations, that's true. Yeah, I think I've heard it, in different ways. They have some stringent guidelines, but individuals don't if you can present that case in a compelling way and be able to share that broadly. And social media is a great way to do that. I mean, we haven't done a GoFundMe page, but it's pretty much close to that, where people can then give and make that happen. So it's just another strategy.
Absolutely. Absolutely. I know for our camp as well, our foundation as a whole, our fundraising decreased, but as far as our camp was concerned, we were fortunate. Since we went virtual, we opened it up to our center's hematology patients as well as all siblings. So because we were able to open it up to those folks, our camp donations actually increased because we were able to target a new audience and a new camp population. So we're hopeful, since as we said, we decided to go virtual, that we will increase those donations again because we're able to offer it out to this new population, which we weren't able to do prior to going virtual. I see, unfortunately, that our time is already wrapping up, which is crazy because I know how much more there is to talk about. But I do want to take a second to offer out to the panel any other closing remarks, any other thoughts, any, if you had to choose like a number one thing that you had to truly think about, and you may have answered this already, but you can definitely reiterate it, as one of your deciding factors for possible in-person or possible virtual, what were those the big ones that you had to go through or are going through in your decision?
So obviously safety was our number one. So what our medical council thought was the most important to us, but then we have the fortune of owning our own site, which gives us a little more time. So we thought about what are our alternatives. Is it easier to plan for camp now and then turn virtual, or plan for virtual and then at the last minute something happens and you can't really reverse that? So for us, we're starting with our traditional residential camp, then maybe just going to healthy survivors and siblings, and then family camp, and hopefully that'll be the lowest we drop. But then, if something catastrophic happens and the state doesn't let us open, then we would just go virtual only. But think of those alternatives, and if you can possibly change things. I know a lot of folks on here have already run family camps, and that's been a good option for them. So I would say look into the alternatives a little bit more.
Thanks, Ryan.
I would say my number one focus is on support from our medical staff. We have a strong partnership with them. Most of our kids are treated at one center, and we depend on the doctors and nurses to staff camp, and we would never move forward no matter how robust our planning was if we could not convince them to feel safe or comfortable about sending the kids. So that'd be our focus.
Thank you, Sal. Thank you.
And I think for me, I always go back to why are we doing this? And by that, I mean is what's the best way that we can create an impact for these kids? What are the bottom lines with that? I've been known in my organization to say I can do camp in a parking lot. Now I can't even do it in a parking lot, in person to person, but I can even do it on Zoom. But my thing is, how do we plan to create those outcomes? And can we do that? Being open is just one of those things that I love about it. But if we can't, if it's not safe and we're not going to hit those outcomes, even with some of the changes we're going to make, is that really the best way? Or is it going to be going virtual? Because that's what we're tasked to do, is to support these kids, take care of them through this experience that they have. And so that's the bottom line for me. And sometimes that gets lost in the logistics of all this. So for me, that's always my guiding light, is how can we make sure we have the best outcome for these kids? And camp to virtual, if there's so many wonders about that, let's pick the best that we can do. So that's been my mantra.
Thank you. Thank you all. It's a hard decision, I'll put it this way. Last year, it was a wonderful year to be president of COCA, because if everything could go wrong in the world, it decided to happen the last year of my presidency, which is great. But I actually found, while the decision to close last year and go, or I shouldn't say close, let me rephrase that. The decision to go virtual last year was a difficult one. I actually found the decision this year was harder to make than last year. Last year seemed to be kind of a no-brainer. Everything was so chaotic. There was so much uncertainty in the world. And this year, while there is so much has transpired and so many good things, I actually found that this year the decision was harder to make. And I found the decision process took a lot longer. We thought about it really and truthfully right after camp last year. We started to talk about it and started to process it. We did not have a large medical leadership team, so that was started right after camp last year, and our current leadership team. So a lot of things have transpired. So I actually, for me at our camp, it was a much harder decision to make this year, and I'm sure for all of you, the decision has been a difficult one. I do want to thank all of you for what you are doing for your camps, regardless if your decision is virtual or in person, because we keep camp alive no matter what we do. So I applaud all of you for your efforts. I applaud all of you for the work that you do. And I thank all of you from the kids, from the families and the donors too. Yeah, honestly, but I'll put it that from the kids, I thank you all for what you do. A special thank you for Ryan, Sally, Brian. I appreciate you all being on the call tonight, sharing what your camps have been working on, the triumphs, the struggles, all of it. Thank you so much for giving of yourself and your time. And thank all of you for being a part of tonight. It's a lot. It's a Wednesday night. It is Wednesday, right? Yeah, because my days are totally off, but it's hump day. So tomorrow is Thursday. So we're on the track to the fun weekend. So thank you all so much. Don is going to put up the slide again, just as a reminder of all of our upcoming sessions. So please, I hope that you all will join us next Wednesday for the Future of Camp Part 2, our Town Hall Part 2. We'll have another amazing group of folks offering up what they're doing, the decisions that they've made. So we really and truthfully hope that you'll join us then. But of course, please join us on the 24th when we talk about what questions need to be asked of your host camps. And of course, join us for our first medical town hall of the year in March. And of course, feel free to come join me in arts and crafts later in March. But no, that'll be it.
I can't wait, Matthew. It's going to be the greatest day of my life.
You know it. You know it.
Thank you, Matt.
Oh, it's been my pleasure as always. So thank you all so very much for joining us tonight. Please keep the conversations going. That's always my biggest thing. Don't let the conversation stop. So ask your friends, reach out. COCA is a family. So if anyone needs anything, as always, reach out to your family. So thank you all so much.
Thank you.
Yeah.